Next chapter is the immunodeficiency. इम्यूनोडेफिशिएंसी में सबसे पहले हम पढ़ेंगे कंजेनाइटल इम्यूनोडेफिशिएंसी, फिर एक्वायर्ड इम्यूनोडेफिशिएंसी. ठीक है. फिर नेक्स्ट टॉपिक रहेगा डायग्नोसिस ऑफ इम्यूनोडेफिशिएंसी और फर्दर रीडिंग्स. तो कंजेनाइटल में क्या क्या आता है? कंजेनाइटल में आता है सीवियर कंबाइंड इम्यूनोडेफिशिएंसी सिंड्रोम, है ना, SCIS, कंबाइंड सीवियर कंबाइंड इम्यूनोडेफिशिएंसी सिंड्रोम. दूसरा है डिफेक्ट्स इन टी सेल्स, फिर डिफेक्ट इन बी सेल्स, फिर पार्शियल डिफेक्ट इन टी एंड बी सेल्स, फिर डिफिशिएंसी ऑफ कम्प्लीमेंट और डिफिशिएंसी ऑफ फेगोसाइटोसिस, है ना, डिफेक्ट्स इन फेगोसाइटोसिस, सॉरी. तो ये था सारा कंजेनाइटल में. अब एक्वायर्ड में क्या होता है? जैसे ड्रग्स से इम्यूनोडेफिशिएंसी हो जाए, इन्फेक्शन से हो जाए, ट्रॉमा एंड सर्जरी से हो जाए, फिर इन्वायरमेंटल पॉल्यूशन से हो जाए, इन सब से भी एक्वायर्ड इम्यूनोडेफिशिएंसी होती है. तो अब इम्यूनोडेफिशिएंसी के बारे में पढ़ते हैं. द स्ट्रगल फॉर एग्जिस्टेंस इज द लॉ ऑफ नेचर एंड एक्विजिशन ऑफ द इफेक्ट ऑफ द एफिशिएंट वेपनरी पेव्स द वे फॉर सर्वाइवल ऑफ द फिटेस्ट. द इम्यून सिस्टम इज वन ऑफ द मोस्ट कॉम्प्लेक्स, यूबिक्विटस, sensitive and specific arsenal required by living creatures to sustain the onslaught of the physical, chemical and biological and environmental adversities. The alteration which decreases the effectiveness or destroy the capabilities of the system to respond to various antigens are collectively designated as immunodeficiency disorder. फिर से मैं बोलता हूँ, बहुत अच्छी डेफिनेशन से. द अल्ट्रेशन विच डिक्रीजेज द इफेक्टिवनेस और डिस्ट्रॉय द कैपेबिलिटी ऑफ सिस्टम टू रिस्पॉन्ड टू वेरियस एंटीजेंस आर कलेक्टिवली डिजाइंड एज इम्यूनोडेफिशिएंसी डिसऑर्डर्स. द प्रिवलेंस ऑफ द इम्यूनोडेफिशिएंसीज वेरीज extensively according to the type of disease, and some of such diseases are rare in occurrence. During last few years, it has been observed that in spite of good managemental practices, various infectious diseases raise their ugly heads even after the implementation of proper vaccination schedule. These precautions situations may be attributed to poorly developed immunocompetence or depressed immune system as a result of environmental factors, genetic factors, drugs, infections, environmental pollution, etc. The immunodeficiency in the animal can be broadly classified into congenital यानी कि primary and acquired यानी secondary immunodeficiencies. सबसे पहले congenital immunodeficiencies. In this type of immunodeficiency, the defect of immunity is generally determined and is present in the animal since their birth. It is also known as primary immunodeficiency. The congenital immunodeficiency is rare in animals and has been reported due to defect in basic cellular components at the time of development. Although the exact cause of such defect is not fully understood, such alterations are expected due to defective genes. These defects may occur during differentiation and maturation of bone marrow elements derived from stem cell and are clinically characterized by symptoms related to the affected cell line and the stage of differentiation at the time of expression of cellular defects. The congenital immunodeficiency disease are recognized early in the life by the appearance of recurrent infection, increased susceptibility to even mild pathogen, poor response to treatment and occurrence of systemic diseases after vaccination with live attenuated vaccines. Most of the immunodeficiency problems are species or breed specific and is very difficult to treat them at later stage. Since these problems are not curable and early diagnosis helps in segregation and elimination of the animal from the herd. The various types of congenital immunodeficiencies are described as under. पहला है severe combined immunodeficiency syndrome. The combined immunodeficiency syndromes occur in the animal due to inherited gene defect. In this syndrome, the stem cells are absent or unable to differentiate into T or B cells. The syndrome is characterized by recurrent infection since birth. Then A gamma globulinemia A gamma globulinemia A gamma globulinemia, absence of T and B lymphocytes and has been reported in Arabian foals. अरेबियन घोड़ों में जो बच्चे होते हैं ना उनमें देखने को मिलता है. The combined immunodeficiency syndrome occurs due to an autosomal recessive gene causing abnormal purine metabolism, and about 3% of all Arabian foals die due to this syndrome before attaining the age of 5 to 6 months. The absence of adenosine diaminase and purine nucleotide phosphorylase leads to accumulation of adenosine nucleotides, which are toxic to lymphocytes. The defective development of T and B lymphocytes lead to lymphoid hypoplasia in thymus, spleen, and lymph nodes, causing A gamma globulinemia and lymphopenia. The other cells in the blood, that is the erythrocytes, neutrophils, and monocytes, are normal. Death occurs due to recurrent infections such as pneumocystis carini and adenovirus infection within 4 to 6 months. अब डॉग की बात करें तो इन द डॉग सिमिलर सिंड्रोम कैरेक्टराइज्ड बाय हाइपोप्लासिया ऑफ थाइमस, lymph node and spleen occur due to combined immunodeficiency. The occurrence of listeriosis in an Arabian foal has been reported due to combined immunodeficiency. Affected foal do not have functional T cell or B cell and have very low circulating lymphocytes count. The maternal antibody are catabolized within 2 to 4 months, and then foals begin to fall sick in the absence of antibodies. Severe bronchopneumonia with adenovirus and rhodococcus equi infection is the predominant finding on post-mortem examination. Spleen of such foals is hypoplastic and lacks in germinal center and periarteriolar lymphoid cells. The lymph nodes are also show lack of lymphoid follicle and germinal center with the depletion of lymphoid cell in the paracortex region. There is hypoplasia of thymus. तो ये था पहला सीवियर कंबाइंड इम्यूनोडेफिशिएंसी सिंड्रोम. अब दूसरे पे आते हैं जो कि कंजेनाइटल होता है, वो है डिफेक्ट्स इन टी लिम्फोसाइट्स. In animals, 3 type of syndromes occur due to T cell defects, which are associated with the production of maturation of cells. तो प्रोडक्शन और मैचुरेशन दोनों को ही अफेक्ट करता है. पहला है थाइमिक हाइपोप्लासिया, occur in the pups and leads to defective T cell function with normal B cell and adequate level of immunoglobulin in the serum. तो सीरम में मतलब इम्यूनोग्लोबुलिन्स नॉर्मल होंगे पर टी सेल डिफेक्टिव हो जाएगा. द पप्स हैव इंक्रीज्ड ससेप्टिबिलिटी टू वेरियस इन्फेक्शन एंड डेथ अकर विद इन फ्यू वीक्स ऑफ लाइफ. अ सिमिलर डी जॉर्ज syndrome occur in the men due to failure of development of the 3rd and 4th pharyngeal pouch leading to aplasia of thymus. Second है in the black pied Danish cattle. ये सब एग्जाम्पल्स हैं. तो सेकेंड एग्जाम्पल है डिफेक्ट इन टी लिम्फोसाइट का. इन ब्लैक पाइड डैनिश कैटल एक्जेंथीमा, एलोपेशिया, क्रस्टिंग एंड पैराकेराटोसिस अकर ड्यू टू टी सेल डिफेक्ट एज ए रिजल्ट ऑफ A46 लीथल ट्रेट. तो एक लीथल ट्रेट आता है A46 में. द अफेक्टेड काउस आर ससेप्टिबल टू वेरियस वायरल, बैक्टीरियल एंड फंगल इन्फेक्शंस. Death occur within 4 months of age. A similar syndrome has also been reported in Holstein calves. The clinical features are lymphopenia, deficiency of zinc and normal level of immunoglobulin in the serum. मतलब B cell तो normal रहता है. On necropsy, the hypoplasia of thymus and T-dependent region of lymph node, spleen and gut-associated lymphoid tissue have been observed. These animals are deficient in T cells and have depressed cell-mediated immunity with normal antibody titer. इसका ही तीसरा एग्जाम्पल है. A third syndrome due to T cell defect occur in the dog is the result of lethal trait A46. This is also known as the lethal acrodermatitis and is characterized by hypoplasia of T-dependent lymphoid tissue and normal level of immunoglobulins in the serum. The affected animal does not show any deficiency of zinc and die within a few months. तो ऊपर वाले में तो फिर भी जिंक की डेफिशिएंसी मिलती है, नीचे वाले में तो जिंक की डेफिशिएंसी भी नहीं मिलती है. अब हम आते हैं कंजेनाइटल में. तीसरा डिफेक्ट है डिफेक्ट इन बी लिम्फोसाइट. द प्राइमरी इम्यूनोडेफिशिएंसी ड्यू टू बी सेल्स डिफेक्ट अकर इन इक्वाइन्स and are also known as equine A gamma globulinemia. This is characterized by normal count of T cell, absence of B cell, and absence of all classes and subclasses of immunoglobulins. This defect is thought to be due to X-linked as it mostly occurs in males. The pathological investigations revealed the absence of primary lymphoid follicles and germinal center in the spleen and lymph nodes. The main defect is considered to be maturation arrest in the B precursor cells. तो B का maturation नहीं हो पाता एक्चुअल में. The absence of plasma cells in the lymph nodes and spleen can be demonstrated. However, such animal possess circulatory lymphocyte in the blood, which shows reaction to phytohemoglobulin, phytohemagglutinin and produces migration inhibitory factor. Type 4 hypersensitivity reaction is unaffected in the animal, indicating intact cell mediated immunity. मतलब टाइप 4 hypersensitivity इसमें मिलेगी ही नहीं. Such foals can survive up to 1.5 years and show high rate of recurrent bacterial infection and absence of B cells. Selective IgA deficiency can be recorded in the dog, which is characterized by recurrent dermatitis and respiratory disease. The IgA deficiency predisposes the mucosa of respiratory and gastrointestinal tract for bacteria and viral infection. It is mainly due to maturation arrest from B cells to IgA secreting plasma cells. The serum level of IgA is absent while that of IgM and IgG is normal. The deficiency of IgA is associated with the presence of rheumatoid factor in the serum of dog. Such dogs are unusually susceptible to chronic small intestinal disorders caused by Microsporum canis. Selective IgM deficiency is characterized by various low level of serum IgM and presence of recurrent respiratory and joint infection in Arabian horses. The clinical manifestation appears at about 1 to 2 months of age, and the both sex of foals do suffer from IgM deficiency. The foals suffered from septicemia caused by Klebsiella pneumoniae or Rhodococcus equi. Except the low IgM level, all other immune responses are normal. ऐसा भी होता है, IgM ही कम हुआ इसमें. अगला है जैसे IgG deficiency has been reported in Danish red cattle and clinically it is characterized by increased susceptibility to pyrogenic infection, gangrenous mastitis, bronchopneumonia and peritonitis. A case with extremely low IgG level was also reported in the foals, which had normal IgA and IgM level but absence of germinal center, lymphoid follicle and periarteriolar lymphoid sheath. The diagnosis can be made by quantitative radial immunodiffusion test. Diagnosis made by quantitative radial immunodiffusion test to demonstrate the missing isotype of antibodies. Transient hypogammaglobulinemia in newborns occur at 4 to 6 months of age. The maternal immunoglobulins are catabolized slowly and the level of these antibodies falls down drastically. The production of immunoglobulins from neonatal lymphoid tissue is delayed, resulting into low level of immunoglobulins in the blood of patient. Normally, the production of immunoglobulins start at 4 to 6 months of age. This condition has been reported in lambs, foals and dogs. During the period of transient hypogammaglobulinemia, the neonate is susceptible to various opportunistic bacterial and viral infection. As the normal production of immunoglobulins resumes, this condition disappears. तो कंजेनाइटल डिफेक्ट में अगला नेक्स्ट आता है पार्शियल डिफेक्ट्स इन टी एंड बी सेल्स. पार्शियल मैचुरेशनल defect in T and B cells are characterized by presence of recurrent infection, eczema and purpura. This condition is considered to be X chromosome linked. The eczematous condition occurred due to increased level of IgE in the blood with low IgG level. The purpura is often associated with the poor platelet aggregation and thrombocytopenia. It can be occurred through bone marrow transplantation from a susceptible donor. कंजेनाइटल डिफेक्ट्स में नेक्स्ट है डेफिशिएंसी ऑफ कंप्लीमेंट सिस्टम की भी डेफिशिएंसी हो जाती है. द कंजेनाइटल डिफिशिएंसी ऑफ कंप्लीमेंट इज वेरी रेयर इन द एनिमल. हाउएवर द deficient complement component are associated with abnormal regulation of immunological response leading to autoimmunity. The complement component C1, C2, C4 are deficient and are usually associated with the systemic lupus erythematosus, polyarthritis nodosa, and glomerulonephritis and rheumatoid arthritis. The deficiency of complement component C5, C6, C7, C8 may lead to occurrence of recurrent infection. The absence of deficiency of C3 complement is usually found to be associated with increased susceptibility to bacterial infection. It has been reported in spaniel dogs and is transmitted as autosomal recessive gene. The level of C3 become as low as 10% of the normal value and is usually associated with bacterial infection due to lack of complement mediated opsonization, chemotaxis and phagocytosis. Congenital में next defects in phagocytosis. It includes defect in neutrophils, monocytes, platelets, melanocytes and eosinophils. The defective phagocytic disorder are usually characterized by neutropenia or defective neutrophil function with regards to chemotaxis, phagocytosis and bactericidal activity, leading to persistent pyrogenic bacterial infections. The cyclic leukopenia is most sensitive indicator of maturational arrest of gamma maturational arrest of granulopoiesis and is of diagnostic significance. Such neutrophils are exhibit ineffective bactericidal activity. The other defect in neutrophils, platelets, melanocytes and renal tubular epithelium are associated with autosomal recessive defect and are designed as Chediak-Higashi syndrome. In this syndrome, the phagocytic cells contain large granules the large granules staineable by peroxidase. Chemotaxis, phagocytosis and killing of bacteria are abnormal and associated with defective assembly of cytoplasmic microtubule responses for degranulation and release of lysosomal enzyme. The depression of superoxide anions, an indication of defective respiratory burst, has been detected through NBT reduction test in dogs with persistent bacterial infection. Transient neutropenia may be observed in the neonates of animal characterized by reduced chemotaxis and impaired phagocytosis by neutrophils. This is of shorter duration and has little significance. अब इसी में आते हैं अपन चेडियक-हिगाशी syndrome क्या है. The Chediak-Higashi syndrome is an inherited disease of cattle and is associated with dilution of hair pigmentation, ocular abnormalities, and increased susceptibility. This may be diagnosed either by examination of blood smear for the presence of large granules within the phagocytic cells or by examining hair shafts for enlarged melanin granules. The enlarged neutrophil granules results from fusion of primary and secondary granules. while in monocytes and eosinophils they are formed due to the presence of large abnormal lysosomes. The large granules of these phagocytic cells are more fragile and liable to cause tissue damage. Such phagocytic cells have defective chemotaxis, motility, and intracellular killing. In animals with Chediak-Hagashi syndrome, there is defective development of natural killer cells leading to increased occurrence of cancer. इसी में आता है पेल्गर ह्यूट एनोमेली, PELGER, पेल्गर ह्यूट HUET, पेल्गर ह्यूट anomalies. Pelger Hewitt anomalies is characterized by failure of neutrophilic nuclei to segment into lobes, and the nucleus remains rounded just like that of the immature cells present in the shift to left. Though it does not affect the health status of animal, the blood picture shows persistent shift to left. Such cells are docile and show poor and slow migration. B lymphocytes are also found defective, and this combination of neutrophilic and lymphocytic defect cause sufficient suppression of body defense and reduced survival of such animals. An autosomal recessive gene has been found responsible for integrin deficiency in the Holstein calves. The disease is characterized by recurrent bacterial infection, delayed wound healing, peripheral lymphadenopathy, and persistent neutrophilia, and death within 2 to 7 months. Such animals show the presence of large number of neutrophils in the vascular system, but these cells are scarce in the interstitium and extravascular location, even in presence of the bacteria. This defect occur in the neutrophils as a result of defective gene of CD18 molecule due to point mutation. As a result of absence of defective integrins, the neutrophils are not able to firmly adhere with the endothelium of the blood vessel wall and migrate into extravascular spaces. Such calves are also show defective T cell response in DTH reaction because CD18 molecule is also responsible for migration of T cells to the site of antigen. The defective neutrophils are shown to have reduced responsiveness to any chemotactic stimuli and decreased superoxide production. However, such cells have increased receptor for Fc portion of IgG, but with poor binding leading to reduced endocytosis and killing of bacteria. तो ये था सारा का सारा अभी तक कंजेनाइटल एबनॉर्मलिटीज़ में. अब आते हैं एक्वायर्ड इम्यूनोडेफिशिएंसीज. The animal may require the suppression of immune system due to drugs, disease, or deficiency of nutrition or neoplasm or environmental pollution, which is clinically manifested by increased susceptibility to infectious diseases. Acquired immunodeficiency, also known as secondary immunodeficiency, is more common than congenital immunodeficiency. The animal may come in contact with several xenobiotic present in the environment that may be toxic to the immune system, leading to immunosuppression. There are mainly 4 groups of acquired immunodeficiency of the immune system. First is drug. Several drugs are known to cause immunosuppression in men and animals. These are include corticosteroids, azathioprines, alkylating agents, cyclophosphamide and cyclosporins A, and many antibiotics have intracellular action and are listed in table this. तो कौन कौन से ड्रग्स कॉजिंग इम्यूनोडेफिशिएंसी से कॉर्टिकोस्टेरॉइड है, साइक्लोफॉस्फामाइड है, एजाथियोप्रिन है, मिथोट्रेक्सेट है, फिर क्लोरम्ब्यूसिल है, फिर ब्यूसल्फेन है, ब्यूसल्फेन है, देन मेलफालन, देन साइक्लोस्पोरिन, देन टेक्रोलिमस का नया नाम आ गया है, रेपामाइसिन, फिर इसके बाद जेंटामाइसिन, ये भी इम्यूनिटी डाउन करता है। एस्प्रिन इम्यूनिटी डाउन करता है। देन एनाल्जेसिक एंड एंटी इन्फ्लेमेटरी ड्रग्स। तो ये कुछ ड्रग्स हैं। अब इसमें अपन डिटेल थोड़ा देखते हैं। द कॉर्टिकोस्टेरॉइड बाइंड विद द रिसेप्टर प्रेजेंट ऑन द सर्फेस ऑफ lymphocyte and thus the T helper cell function is reduced. Long term therapy with the steroid leads to decreased antibody level in the serum. फिर दूसरा आता है एजाथियोप्रिन। एजाथियोप्रिन इज मोस्टली यूज टू रिड्यूस द ग्राफ्ट रिजेक्शन in case of transplantation of the tissue or organ. This drug acts as purine analog and inhibits synthesis of DNA, RNA and protein in lymphoid cells, leading to suppression of antibody synthesis, particularly IgG in animals. अगला आता है साइक्लोफॉस्फामाइड एंड क्लोरम्ब्यूसिल। जो साइक्लोफॉस्फामाइड एंड क्लोरम्ब्यूसिल है are used to treat malignancies which affect the DNA replication in T and B lymphocyte, leading to alteration of surface markers and defective functional activity. However, the macrophage functions are not altered. इसमें मैक्रोफेज का फंक्शन अल्टर नहीं होता, बाकी टी और बी सेल का अल्टर्ड हो जाता है। नेक्स्ट है साइक्लोस्पोरिन ए। साइक्लोस्पोरिन ए इज ए फंगल मेटाबोलाइट which has antibacterial activity. It is used to depress the cell-mediated immune response in order to accept the bone marrow or renal transplant. It affects the T cell lymphocytes, leading to maturation arrest, altered response of T cell to growth factor and interleukins. Several anti-inflammatory agents are used in the animal in order to reduce swelling and to check the allergic reaction. This drug inhibits lysosomal enzymes activity, decrease phagocytosis and local inflammatory reaction. This drug also inhibits the growth of lymphocytes and cause immunosuppression. Next, aspirin. Aspirin is used to treat the rheumatoid arthritis in the dog. It has some adverse effects like reduced platelet aggregation, decreased phagocytic activity of neutrophils, and suppress of lymphocytic functions. Phenylbutazone is also acts like aspirin and cause immunosuppression. तो ये तो थी सारी ड्रग्स के बाद आते हैं अपन इन्फेक्शंस पे। तो मैनी इन्फेक्शियस एजेंट आर नोन टू कॉज इम्यूनोसप्रेशन इन द एनिमल either by directly acting on immunocytes or through action on the cytokines and activation of T suppressor cells. तो ऐसी पूरी एक टेबल है इसमें आगे। तो अभी अपन एक एक करके बात करते हैं। पहला है बोवाइन हर्पीस वायरस। Bovine herpes virus 1 infection is known to cause abortion in the cattle, melanopostitis in bull, pneumonia and meningoencephalitis in calves. This virus also caused decrease in peripheral blood CD4 and CD8 lymphocyte. The reduction in cytotoxic T cells have been reported in calves affected with the bovine herpes virus 1. Likewise, equine herpes virus यानी कि EHV1 is also found to be associated with the depression of non-specific T cell function in the horses. This is clinically characterized by leukopenia, neutropenia, and or lymphopenia. Marek's disease virus suppresses the mitogen-induced lymphocyte proliferation. It acts as a lymphocytolytic agent in the lymphoid follicle of bursa, spleen and thymus in poultry. The virus affects both T and B cell. The immunosuppressive activity is mediated by glycoprotein present on the various envelope. Next है virus bovine viral diarrhea. Virus causing reduction of CD4 and CD8 T lymphocyte and B lymphocyte and neutrophil in the cattle. In vitro studies indicate that the virus inhibits production of interleukin 2 and lymphocytes. Respiratory syncytial virus infection in the lambs makes them more susceptible to secondary bacterial infection by Pasteurella multocida. This virus is known to inhibit live antigen specific immunoproliferative responses in the sheep and cattle. It also reduced production of CD4 T helper cell in the peripheral blood of sheep. नेक्स्ट वायरस है ब्लू टंग वायरस। ब्लू टंग वायरस infects the CD4 and CD8 T lymphocyte and cause their destruction. The border disease virus is known to depress the T cell and T helper cell and T cytotoxic lymphocyte responses in the limb. Canine parvovirus also infects immunocytes and causes their destruction, which leads to the depletion of lymphoid tissue in the body. Canine distemper virus activates the T suppressor cells, which are responsible for immunosuppression. नेक्स्ट वायरस है इन्फेक्शियस बसल डिसीज़, इसको हम गम्बोरो डिसीज़ भी कहते हैं. तो इन्फेक्शियस बसल डिसीज़ वायरस selectively infect pre-B lymphocyte in the bursa of fabricus. The immunosuppressive effect is associated with the IgM bearing cell in the spleen and blood. It depresses 1A molecule expressing cell in the bursa and spleen with no alteration in the bone marrow lymphocytes. Infectious laryngotracheitis virus infects macrophages and replicate in them, leading to their destruction. Feline leukemia virus infection is associated with the lymphoid depletion, glomerulonephritis, defective macrophage, and deficient complement. The viral DNA present in the bone marrow, lymphoid tissue, and intestines has been considered to be the cause of viral-mediated cytotoxicity of lymphocyte. It also suppresses the production of interleukin-2 because of viral proteins, binds with CD4 lymphocytes. Feline immunodeficiency virus, a lentivirus, is known to cause neutropenia and lymphopenia. The immunosuppression caused by this virus is due to inhibition of T and B cells cooperation. The virus selectively infects CD4 cells and kill them by कैसे किल करता है ये? By poorly understood mechanism. पता ही नहीं है इसके बारे में. नेक्स्ट वायरस की बात करें, वायरस इम्यूनोडेफिशिएंसी वायरस. बोवाइन इम्यूनोडेफिशिएंसी वायरस is also a lentivirus of Retroviridae family. The virus is exogenous, non-oncogenic, and causes persistent infection in the cattle. The virus replicates in the macrophages and CD4 lymphocytes and cause their destruction and immunosuppression. The lymphocytes and the virus can be transmitted horizontally by intravenous inoculation into the calves. On entry of the virus into these cells, it may remain latent even up to whole life without causing any clinical illness. However, sometimes it causes lymphoadenopathy, lymphocytolysis, progressive weakness, and emaciation. The immune response to the virus starts initially at about 3 weeks after infection. Antibodies can be easily detected by a Western blot technique. NK cells and antibody-dependent cell-mediated cytotoxicity mechanisms also operate stimulus simultaneously, but none of these mechanisms succeeded in the controlling of bovine immunodeficiency virus infection. The immune response declined shortly after onset of the clinical disease due to necrosis of antigen-presenting cells, that is the macrophages and dendritic cells, reduction of B lymphocyte, reduction in the lymphokines production, and supervisor factor and genetic variation affecting critical viral epitopes. तो ये जितना भी था ये वायरस ओरिएंटेड या इन्फेक्शियस एजेंट ओरिएंटेड एक्वायर्ड इम्यूनिटी डेफिशिएंसी था. अब आते हैं ट्रॉमा एंड सर्जरी. The physical trauma or surgical operation may also leads to reduction in the specific immune response and the functional capacity of phagocytic cells, particularly macrophages. Such defects are transient and may become normal after healing of trauma or surgery. The depression of macrophages function is due to reduction of lymphocytes, lymphokines, monokines, and other chemotactic factors. It also increases the number of T suppressor cells and depresses the T cell function. Corticosteroids, prostaglandins, suppressive peptides, etc., released during trauma and surgery causes immunosuppression, affecting many T cells and B cells. Function are usually T cell and macrophages. B cell function are normal at that time. It leads to impairment of type 4 hypersensitivity reaction, allograft rejection, and T dependent antibody response. This is a reduction of interleukin 1 and interleukin 2 production. There is reduction in the interleukin 1 and interleukin 2 production. तो ये था अपना ट्रॉमा एंड सर्जरी कारण. अब ये होता है इन्वायरमेंटल पॉल्यूशन के कारण भी. Rapid advancement in the human civilization has introduced in our environment a large number of synthetic chemicals such as pesticides, heavy metals, etc. Pesticides are widely distributed and used in agriculture, animal husbandry, and public health operations throughout the world. Majority of this compound are beneficial when used jurisdictionally. However, many of them becomes contaminated due to their persistence in the ecosystem, that is in the soil, water, plant and animal tissues. The residue have been found in the human and animal food and dairy products of the animal origin. On eating such food, the residual compounds reach the tissue of the man and animal and produce deleterious effect there. अब इसमें the tens of thousands of chemicals are being synthesized each year and disseminated to various degree into the population. The immune mechanism is highly susceptible to this chemical present in the environment, leading to immunosuppression. Pesticides are classified as insecticide, weedicides, herbicides, rodenticides, and fungicides. Of these, insecticides assumes greater significance because of their much high shares, that is about 77% in the total pesticide application in the agriculture. Insecticides are further grouped as organochlorines, organophosphates, carbamates, and synthetic pyramides. Synthetic pyrethroids have been shown to exert deleterious effect on macrophage function. DTH reactions and serum biochemical attributes. Similar endosulfan and cypermethrines have also been found severely alter macrophage function. Immune system is considered to be the most sensitive indicator of toxicity, especially for the environmental pollution, which may have a residual effect in the ecosystem. The organochlorines and the organophosphate group of pesticide are more immunotoxic than carbamates and synthetic pyrethroids. Many of the organochlorine compound जैसे कि DDT है, Myrex है, एंडोसल्फान है, लिंडेन है, एल्ड्रीन है, डायल्ड्रीन है, are known to cause reduction in the humoral as well as the cell-mediated immune response in the animal and poultry. This pesticide appears to be more potent, but many have residual effect in the ecosystem and comparatively more harmful to non-target animals. Endosulfan may cause immunodepression and reduction in the macrophage function in the poultry. Linden, a gamma isomer of BHC, has been found to cause reduction in the NBT positive cells in the lambs. Organochlorine pesticides are also known to cause immune complex mediated glomerulonephritis in lambs and poultry. The organophosphate group of pesticides are increasingly used due to the occurrence of resistance to organochlorines in insects and pests. The immunosuppressive effect of low level of parathion, malathion, and samithion and monocrotophos has been reported in the animal and poultry. The suppression of cell-mediated immune response has been observed due to low dose of malathion in the poultry. Monocryptophos is found to have depressive effect on bactericidal activity of macrophages in the lamb. Carbamate group of pesticides are being used in various agriculture and animal husbandry practices due to their high efficacy and greater safety. However, even in no observable effect level, यानी कि NOEL, NOEL. However, even in no observable effect level, this pesticides causes immunosuppression in the animal and poultry. Carbaryl was found to affect cell-mediated immune response in the chicken when given at NOEL. Does for 2 months. Carbofuran affects both humoral as well as cell-mediated immune response in the lamb. It is also found to have adverse effect on the macrophage function in the lambs after oral feeding for a period of 6 months. The synthetic pyrethroid pesticides are considered to be stable and highly toxic to insect and relatively less toxic to animals and do not accumulate in the environment. However, immunosuppression in goats have been recorded when fed with low dose of cypermethrin. It exerts an immunodepressive effect on both the wings of immune system. A synthetic pyrethroid D-trans-elythrine, a common pesticide used as a mosquito repellent in most of the commercial mats, was also found to have immunotoxic effect on the humoral and cell-mediated immune response in the mice. Cypermethrin was found to suppress the humoral response and the DTH reaction in the chicken at very low doses. Delayed type of hypersensitivity reaction in the chicken. Besides, there is many heavy metals like lead, mercury, copper, cadmium, etc. found in the environment as pollutants, which produce immunotoxic effect on non-targeted animal species and men. Lead when given to chicken at NOEL dose for 8 weeks in the water exerted depressive effect on humoral as well as cell-mediated immune response. Also, it was found to decrease the macrophage function. Likewise, mercury is also known to cause immunosuppressive effect on both the wings, that is the humoral and CMI in the poultry. The study of immunopathological effect of cadmium in the bovine calves includes its immunosuppressive effect on the humoral and cell-mediated immunity. It reduces the number of CD4 and CD8 cells in the bovine calves. The immunosuppressive effect of environmental pollutants on the animal and man is not yet fully investigated. Many pollutants do not affect the immune system slowly and after a longer period and even after many generations, the resistance of body gets lowered and the individual becomes more susceptible to various infectious diseases. In spite of vaccination and good managemental condition, the disease outbreak do occur in the population exposed to environmental pollutants. Mycotoxin present in the food may produce their toxic effect on the lymphoid organs, leading to immunosuppression and occurrence of disease outbreak in the animal and man. Aflatoxin, the main culprit in this series, is mostly present in the poultry feed, causing hepatotoxicity and immunosuppression in the birds. अब इसका डायग्नोसिस कैसे करें? तो डायग्नोसिस ऑफ इम्यूनोडेफिशिएंसी. The diagnosis of immunodeficiency diseases can be made by detection of immune response against any kind of antigen or non-specifically by measuring gamma globulin and antibody level in the serum. For the detection of humoral immune response, serum globulins or gamma globulins can be measured by electrophoresis and spectrophotometric method. However, more precise and accurate results can be obtained by ELISA using sera of patients. Isotype specific conjugates are available commercially, which can be used in indirect ELISA to measure the titer of IgA, IgM, IgG, IgE. If the facility of ELISA reader is not available, immunobinding assay, immunobinding assay using dipsticks can be used. This assay is comparatively less expensive and quick, and results can be read by naked eye. The dipstick can be stored for a longer period of time without any deterioration. The B lymphocyte responses can be observed by culturing lymphocytes from peripheral blood, spleen, lymph nodes, or bursa of Fabricus. Using the mitogen LPS, the lymphocyte transformation or blastogenesis can be observed, which will be useful for detection of B cell activity. The cell-mediated immunity, that is CMI, is evidenced by T cell function, can be measured by culturing the lymphocyte from peripheral blood or spleen in the presence of mitogen. Mitogen, for example, जैसे CONA or PHA, and their transformation is detected by thymidine or MTT dye method. The transformation of lymphoid the transformation of lymphocyte in the presence of PHA or CONA is directly correlated with the cytotoxic action of T lymphocytes. However, if MAB maps for CD4 and CD8 molecule are available, one can measure the T helper cell or T cytotoxic mediated immune response, especially using peripheral blood or tissue section of lymphocyte organs by immunoperoxidase method. Another method of assessing cell-mediated immune response is the delayed type of hypersensitivity reaction, in which specific or non-specific antigen is applied on the skin and there is hot, painful and indurated swelling after 48 to 72 hours. If the CMI response is present, the increase in thickness can be measured by vernier caliper. In order to assay the macrophage function, macrophages can be collected from peritoneal fluid after injecting some irritants. Monocyte can be directly collected by peripheral blood. The functional activity of these cells is assessed by nitroglycotretazolium yani NBT reduction test or by their bactericidal activity. C3 component of complement can be easily quantitated by radial immunodiffusion test. The complete measurement of the complement is determined by total hemolytic activity, in which fresh serum from patient is incubated with antibody coated with sheep red blood cell. The lysis of sheep red blood cell due to presence of complement in the serum is measured by colorimetrically. However, to be more specific, the component of complement are measured using anti-species complement conjugates by ELISA, and the titer correlated with quantitation of complement. Abnormalities in lymphoid organs are determined grossly or necropsy examination. It is also helpful in determining the size, shape and weight of the lymphoid organ. The tissue reaction is assessed histopathologically. Tissue piece from lymphoid organs like spleen, bursa, thymus, lymph nodes and mucosa associated lymphoid tissue are processed and examined as per routine histopathological procedures of hematoxylin and eosin stain. The examination of tissue section of lymphoid organ for depletion, necrosis, congestion, hemorrhages and fibrosis or any other significant alteration gives an idea of damage and structural and functional status of the organ. The interpretation of histopathological examination is quantitatively analyzed in relation to modifying factors such as age, sex, strain of animal, housing condition and nutritional status. A three-tier approach has been adopted for the assessment of immunodeficiency by National Institute of Public Health and Environmental protection, the Netherlands and the USA, the Netherlands and the US National Toxicology Program, which includes hematological parameters such as TLC, DLC, ALC, ANC, weight of the body, weight of the thymus, spleen, bursa, lymph node, and functional test for CMI, and humoral immune responses, and NK cell activities. So these are all about chapter number 2, immunodeficiency. Now next come to chapter number 3, hypersensitivity, by veterinary immunopathology by Dr. R.S. Chauhan.